Hi guys, welcome to day 17 of the Arora AKT 30-day challenge. Hopefully you're having a great day. Time is ticking on. We're almost there now, 2 weeks to go until the exam itself. Hopefully you're feeling confident. Hopefully you've still got some energy because this final push is really important. And thank you to everybody who's followed the previous 16 questions. Welcome if you're doing your very first one today. Hopefully you can go back and watch all previous 16 if you haven't seen them already. And even if you have, hopefully you can start to go back from 1, 2, 3 onwards now, just to get a second go at the question and see if you've made progress both from a knowledge and a technique point of view. So we're back to clinical again today. So we're going to give you 57 seconds to have a think about this question before we come back and do some teaching on the other side. So I'm going to go silent. 57 seconds. Off we go. Okay guys, that is time. Now a lot of the questions we've done till date have probably been a bit short of time. 57 seconds may not have been enough, but this kind of question is where you hopefully can make up some time. This is just one that hopefully you don't have to spend too long on. Hopefully you know the numbers and you can just get the answer quickly. So the answer is A. Well done if you got A. You're reviewing a patient who has hypothyroidism and you notice there's been a change in BMI since last attendance. Which of the following BMIs doesn't match the associated BMI? So that's which of the following BMI doesn't match the associated category, but I'm sure you knew what I meant when you did that question. The answer is A, obesity 2, BMI 34. That doesn't fit the categories, which we'll go through in a second. Hopefully you picked that up. Can be a little bit confusing with the numbers being close together, but hopefully you got this okay. So the answer is A, but what are the key take-home points about obesity then? So firstly, to get those numbers fixed in your mind, so a BMI between 18.5 and basically 25 is your healthy weight. BMI between 25 and 30 is overweight. BMI 30 to 35 is obesity 1. BMI 35 to 40 essentially is obesity 2. And then any BMI above 40 would come under the obesity 3 category. So the first thing to remember is a BMI 30 and above is obesity. And then you have obesity 1, 2, and 3 in further steps. So if you look, obesity 2, BMI 34, that doesn't fit because obesity 2 is 35 to 39.9, but all the others are fine. Healthy weight, BMI 19, overweight, BMI 29. BMI 41 would be obesity 3, and a BMI 31 would fit in the obesity 1 category. So well done if you got A. If you get questions on obesity, remember there may be some underlying medical causes, so look out in the question. Make sure you're not missing things like polycystic ovarian syndrome or hypothyroidism, like in this question, Cushing's, for example, some rare genetic causes. And also medications, maybe they're taking sulfonylureas or lithium or have been on steroids for, polymyalgia rheumatica for a long time, for example. So make sure these kind of things don't get missed in questions in terms of potential causes. Of course, lots of complications that come alongside obesity, increased cardiovascular disease risk, diabetes, increased risk of depression, cancer, fertility, issues can develop, and also, of course, musculoskeletal problems can develop over time as well. You may get questions on medications, so lots of interventions to help with obesity, but in terms of medications, then worth knowing the guidance around orlistat. Orlistat, remember, is a pancreatic lipase inhibitor, and if someone is on orlistat or if orlistat is started and you're reviewing them back, then you should be looking for this 5% drop in weight at the 12-week point. So if you haven't achieved that 5% weight, in theory, you should stop the orlistat because it's not having the effect that we're looking for. When would you think about it? When someone is at a BMI of 30 or above, or a BMI of 28 and above, if they have a certain risk factor like diabetes, hypertension. There's a few others as well. Liraglutide may come up in questions. It is an option for weight loss, but it needs secondary care advice. So if you get a question and you see liraglutide in the option, does the question say something that you can start? Does it say an option within management? And these things are all really important, because you'll think liraglutide, yes, that's an option, but where, what is that actually asking about? Is it asking about primary care options or general options? And these things, again, are very important to pick up in questions. And we talked about some of these things in previous questions, so go back and watch those. Weight loss surgery becomes an option at BMI of 40 or above, but slightly earlier, BMI of 35, if someone's got a health problem that would benefit from weight loss. And weight loss surgery becomes first line as per NICE-CKS once someone reaches a BMI of 50. So BMI of 40 becomes an option, BMI of 50 would become first line. So management of obesity, worth going through the NICE-CKS guidance, know your numbers, don't miss other causes potentially that could be there in the question for you to pick up, and then know your guidelines in terms of medications, but also weight loss surgery as well. Probably last chance now to get these flashcards, I'd say, before your exam. There are a couple of weeks to go. We post these out the day after you purchase, and they'll be with you hopefully within 1 to 3 days after you purchase. But if you need a final boost just to kind of go through core guidelines, obesity is on one of these somewhere, then worth getting these cards. We post them out to your house, and they cover a lot of high yield content, all based on NICE-CKS guidelines, which is ideal for your AKT. Use them wherever you are. Some people split them into going through 10 at a time, or reading the whole batch in one go, or kind of going chapter by chapter or topic by topic, or look at it, as you go through a patient, then you flick at the card. There's various ways of using it, but hopefully they can add value to your last couple of weeks. And make sure you use the coupon Arora Video 10 for 10% off any of the AKT stuff that we do, not just the cards, but the online courses, the audios, the mocks, the gold passes, the live courses, the posters, depending on where you are in your preparation. But just make sure you use that coupon Arora Video 10 for that 10% off. Hopefully these can be of value. If you've got these already, then hopefully you're using them, and you're going to use them heavily in the next couple of weeks before your AKT. See you tomorrow for another clinical question. #CanPassWillPass. #I went with Arora. See you soon.